Elizabeth Taylor, an iconic figure in Hollywood, became a household name due to her captivating beauty, dazzling performances, and tumultuous personal life. She starred in some of the most memorable films of the 20th century and was known for her passionate love life, her impressive acting career, and her dedication to humanitarian causes. Yet, while the world was fascinated with her life, there was a side of Elizabeth Taylor that remained hidden from the public eye. Her fierce and ongoing battle with various health issues in the years leading up to her death in 2011. Born on February 27, 1932, Elizabeth Rosamond Taylor, as she was originally named, began her acting career at a young age. Her beauty was unmistakable even as a child, and it wasn't long before Hollywood took notice of her. She appeared in several films in her early teens, but it was her portrayal of the tragic heroine in National Velvet, 1944, that catapulted her to fame. The world saw a young, perfect, and glamorous Elizabeth Taylor on screen. But beneath that beauty, she was already facing personal health issues that would follow her throughout her life. Elizabeth's first serious health battle occurred early in her life. At the age of 2, she contracted pneumonia, which nearly claimed her life. She was hospitalized for weeks as doctors fought to save her, and while she ultimately recovered, her parents were left deeply concerned about her fragile health. From a young age, Elizabeth was exposed to the idea that her health could be fragile. The constant medical attention she received left a lasting impression on her. However, her career flourished, and by her teenage years, Elizabeth had become one of Hollywood's brightest young stars. As she rose to fame, her health concerns took a back seat. Throughout her career, Elizabeth would battle various health challenges. Elizabeth Taylor's most significant health issue began to manifest in her later years. The condition, which affects the heart's ability to pump blood and oxygen effectively throughout the body, is often slow to show its symptoms, but can become deadly over time. In the late 1990s, Taylor was diagnosed with congestive heart failure, a condition in which the heart is no longer able to pump blood efficiently, causing fluids to build up in the lungs and other parts of the body. Despite her diagnosis, Elizabeth continued to work, making public appearances and even traveling internationally for charity events. Her doctors worked tirelessly to help her manage the symptoms, and she underwent several medical procedures to address her heart condition. In 2004, things took a turn for the worse. Her doctors recommended that she undergo surgery to have a pacemaker implanted in her chest to regulate her heart rate and help with the rhythm problems caused by her heart disease. And for a time, the pacemaker helped keep her heart functioning. However, Elizabeth's health continued to decline. The toll of her heart disease was not only physical but emotional as well. Elizabeth once commented that she felt betrayed by her own body. As an iconic actress, the change in her appearance was not just a personal matter, but a public one as well. The world watched as the woman who had been considered the epitome of beauty and grace now faced an invisible battle that she couldn't fight with her usual charm and poise. Despite these struggles, Elizabeth Taylor's resilience remained unmatched, participating in charity work and spending time with her children and loved ones. In addition to her heart disease, Elizabeth Taylor was also grappling with arthritis, a chronic condition that causes pain and stiffness in the joints. This condition made it increasingly difficult for Taylor to move freely, and it added another layer of difficulty to her already complex health situation. The arthritis took a toll on her mobility, and she frequently had to use a cane to assist with walking, especially in her later years. It was an intensely painful condition that not only caused physical limitations, but also tested her emotional strength. Despite her ongoing health issues, Elizabeth never let her arthritis define her. She continued to make public appearances and maintain her professional life as best as she could, but the chronic pain from her arthritis affected her daily routine. In interviews, she would often mention how she would push through the pain for her fans and for the causes she believed in, but privately, the pain sometimes became overwhelming. As she got older, it became increasingly difficult for her to attend events or keep up with the pace of her once glamorous lifestyle. Taylor's health struggles were something she tried to hide from the public eye, preferring to keep her dignity intact. In addition to the heart disease and arthritis, Elizabeth Taylor also faced a number of cancer scares throughout her life. She then underwent a brain tumor removal surgery in 2004. These were just some of the cancer diagnoses she fought off in her lifetime, and they seemed to serve as a reminder of how fragile her health was, despite her status as a Hollywood legend. Her most serious health concern came when she was diagnosed with brain cancer. Taylor underwent surgery to have the tumor removed. She spent months recovering from the surgery. It was a difficult time for her, and while she appeared strong on the outside, her body was dealing with more than anyone could imagine. During this time, her personal life was also being affected by her declining health. She became more withdrawn. Her ongoing health issues were not only physically draining but emotionally exhausting as well. In addition to her heart disease, arthritis, and cancer, a chronic condition that affects the body's ability to regulate blood sugar levels. Diabetes is known to cause fatigue, frequent urination, and excessive thirst, among other symptoms. For Taylor, managing her diabetes became a priority in her daily life. It meant more frequent doctor visits, constant monitoring of her blood sugar, and adjustments to her diet and lifestyle. Diabetes also complicated her other medical issues, making her already difficult battle with health even more challenging. Despite all of these challenges, Elizabeth Taylor's commitment to her philanthropic work remained unwavering. She devoted much of her time to raising funds for AIDS research, and she continued to be a vocal advocate for HIV/AIDS awareness even when her own health was in a critical state. Taylor's work with the American Foundation for AIDS Research, AMFAR, helped raise millions of dollars to fight the disease. Her fight against AIDS became one of the defining causes of her life, and it gave her strength even in her weakest moments. By the time Elizabeth Taylor reached her final years, her health had deteriorated significantly. Her congestive heart failure had become more pronounced, and her other health issues had compounded. In the last year of her life, she was rarely seen in public, and she had largely withdrawn from the spotlight. On March 23, 2011, Elizabeth Taylor passed away at the age of 79 due to congestive heart failure. Her death marked the end of an era in Hollywood, and the world mourned the loss of one of its most beloved and iconic figures. Elizabeth Taylor had fought an incredible battle with her health in the final years of her life, and while the public was aware of some of her struggles, there was so much more that she kept hidden. Throughout it all, she showed immense strength and resilience. In the years after her death, her legacy as an actress, humanitarian, and icon continues to live on. Elizabeth Taylor's strength in the face of adversity, both in her career and personal life. Elizabeth Taylor may have been known for her beauty and her fame, but it was her strength and determination that truly made her a legend. Her battle with health, fought in silence, only added to the depth of her character, making her an even greater icon than ever before. Her legacy will always be remembered not just for her stunning performances on screen, but for the way she lived her life with resilience, courage, and an unwavering spirit.